Gentlemen, I want to walk you through something that may sound unusual at first. A tennis ball, just a standard tennis ball. And when it's used in one very specific way, for about 60 seconds, some individuals notice increased blood flow to the pelvic area, which may support firmness more quickly than expected. Now, I understand the reaction you might be having. You may be wondering what a tennis ball could possibly have to do with this. That reaction is completely reasonable. When I was first introduced to this method, I felt the same hesitation. But after observing responses in clinical settings and reviewing how nerve pathways and reflex responses work, the concept began to make sense. Many people are unaware that certain areas of the body are closely linked through the nervous system. These connections have been recognized in traditional practices for thousands of years, and modern research suggests there may be neurological explanations behind them. Before explaining the technique itself, it helps to understand the foundation behind it. Your body follows a neurological map. The nervous system connects every region through complex pathways that transmit signals constantly. One area with an especially high concentration of nerve endings is the sole of the foot. Thousands of sensory receptors are packed into a relatively small space, each linked to different systems throughout the body. This concept is known as reflexology. It is not a recent trend, and it is not mystical thinking. Reflexology has been documented in traditional Chinese medicine for over 3,000 years. Contemporary studies indicate that stimulating certain areas of the foot can activate responses elsewhere in the body through nerve signaling. There is one particular spot on the foot that is commonly associated with the pelvic region, including structures involved in circulation. When pressure is applied to this area in a controlled way, it may send activation signals through the nervous system that encourage increased blood flow to the pelvic area. In traditional practices, practitioners carefully mapped these connections and identified areas that function like control panels. When stimulated correctly, these areas can influence distant parts of the body. This specific region has long been associated with circulation support, overall vitality, and sexual health. The nervous system does not operate based on physical distance. Signals travel rapidly, from the foot, through the spinal cord, to the brain, and back toward the pelvic region in fractions of a second. This is why precise placement matters. Accuracy is essential here. If pressure is applied even a few centimeters away from the correct location, the response may be minimal or absent. The nerve response depends on exact positioning. Here is where the technique begins. You will be placing the tennis ball under your foot, specifically beneath the heel. This may sound surprisingly simple, but it aligns directly with the nerve map. Step 1. Sit comfortably in a chair or stand near a wall so you can maintain balance. Remove your shoe and sock so the foot has direct contact with the ball. Step 2. Place the tennis ball on the floor and position your heel directly on top of it. Not the arch, not the toes, the heel. This is where the reflex point linked to the pelvic region is commonly identified. Step 3. Apply steady, firm pressure downward. You should feel compression, but not sharp pain. The pressure should feel controlled, as though you are gently pressing the ball into the floor with your body weight. Step 4. Begin rolling the ball slowly in small circular motions beneath your heel. Roll clockwise for 30 seconds, then reverse direction and roll counterclockwise for another 30 seconds. Keep the pressure even throughout. Step 5. Focus on your breathing. Inhale through your nose for 4 counts. Then exhale slowly through your mouth for 6 counts. This breathing pattern supports relaxation and may enhance nervous system signaling. That completes the technique. 60 seconds in total. Firm pressure, slow circular movement, and calm, steady breathing. What may be happening internally is a coordinated nervous system response. Pressure applied to the reflex point can stimulate peripheral nerves, which communicate with the spinal cord and brain. The brain may respond by supporting increased blood flow to the pelvic area. At the same time, slow breathing can activate the parasympathetic nervous system, the system associated with relaxation and natural vascular dilation. For expectations, it's important to stay realistic. During the first few sessions, some individuals notice tingling in the heel or along the leg. This can be a sign of nerve activation. Others report a sensation of warmth in the pelvic area within a short time. With daily use over several days, some men notice changes such as improved morning firmness or increased sensitivity. Over 1 to 2 weeks, responses may become quicker or more consistent, likely due to repeated stimulation of the same nerve pathways. Consistency matters. One session may provide a temporary effect, but repeated daily activation over 2 to 3 weeks is what supports longer-lasting nervous system adaptation. A common routine is 60 seconds per foot, once in the morning and once before bed. 2 minutes total per day. Both feet should be used to maintain balanced stimulation. There are a few optional ways some people enhance the experience. Using the technique after a warm foot soak may help, as warmth supports circulation and nerve sensitivity. Light thumb massage on the same heel area before using the ball can also prepare the tissue. Some individuals find that visualization, calmly imagining blood flow increasing, helps reinforce relaxation and focus. This method can also be used shortly before intimacy, as part of a calming preparation routine. Safety is important. Anyone with neuropathy, diabetes-related foot conditions, or open wounds should consult a healthcare professional before trying this. Avoid using very hard objects, such as golf balls, if your feet are sensitive. A tennis ball generally provides an appropriate balance of firmness and comfort. The key takeaway is this: the body contains pathways many people never consciously engage. With gentle, consistent stimulation and patience, some individuals find that these pathways respond in supportive ways. I'm Dr. Sarah Bennett. Listen to your body, approach techniques responsibly, and allow consistency, not force, to guide results.